Hi, my name is Stacy Villagran, and I'm the Senior Director of Health Insurance Programs at the Nassau-Suffolk Hospital Council. Thank you for joining me today while I discuss enrollment assistance and Medicaid for adults and children disabled or blind and anyone over the age of 65. Since 2000, Nassau-Suffolk Hospital Council has provided application enrollment assistance for Medicaid free of charge. We're currently providing assistance to adults and children who are disabled or blind and anyone over the age of 65 in partnership with Suffolk County Department of Social Services throughout Nassau and Suffolk counties. Currently, we are providing assistance by phone during the COVID pandemic. Enrollment staff complete and sign the application with your permission and send it to the local Department of Social Services for processing. Trained staff at Nassau-Suffolk Hospital Council will assist in completing the Access New York application, which is the Medicaid application that involves household size and income, and the Supplement A, which involves resources. Minimal documents are required during the COVID pandemic, and staff communicate with applicants throughout the process and inform them of any additional information needed by the local district. And as always, we continue to advocate, track, and monitor every application sent to the local departments of social services until a determination is made. Medicaid for the aged, blind, and disabled is processed through the departments of social services as opposed to the online marketplace that some of you may already be familiar with. This Medicaid is also referred to as non-Magi Medicaid. And the programs that fall under non-Magi Medicaid are Community Medicaid, which involves doctors, specialists, and prescriptions. Long-term care, which covers home care services and brief hospital stays. Chronic care, which covers nursing home and other permanent inpatient settings. And the Medicaid Excess Income Program, also known as the Spend Down Program. And Medicaid buy-in for working people with disabilities. Medicaid for adults and children in need of home and community-based waiver services are also included. And I just want to stress that this is a paper application that is mailed directly to the local departments of social services. So gross income level is used for non-Magi Medicaid to determine eligibility, which I had mentioned is up to 100% of the federal poverty level. Medical premiums are deducted from the income, such as the Medicare Part B and Part D premiums and private insurance premiums that folks pay for. There is also a resource test. So the income level for 2020 for a household size of 1 is $875 per month. The resource level for 2020 is $15,750. For a family size of 2, the income level goes up to $1,284 with a resource level of $23,100. Community Medicaid coverage covers outpatient primary care, specialty care, and hospital care. Inpatient psychiatric care and substance use disorder rehabilitation with a stay of 29 days or less is also covered, as well as prescription drug benefits. And for the resource test, it's just an attestation of current resources. For long-term care services, this includes everything that I just mentioned in community coverage, including adult day health care, limited licensed home care, private duty nursing, hospice in the community, the hospice residence program, the assisted living program, consumer-directed personal assistance programs, personal emergency response services, managed long-term care in the community, and the home and community-based waiver services. Now, for the New York State 2020-2021 budget, it includes a major change in eligibility for long-term care. And applications for Medicaid coverage for community-based long-term care services will have a 30-month transfer of assets looked back period, similar to applications for nursing homes. The original date of implementation was supposed to be October 1st of 2020. However, it was postponed under the Families First Coronavirus Response Act. It is anticipated that April 1st, 2021 will be the new implementation date, but it is pending CMS approval. If non-exempt transfers are made, the applicant will be subject to a period of ineligibility, also referred to as the penalty period, based on the amount of the transfer. When it comes to chronic care coverage, this covers coverage for long-term care facilities like a nursing home. Medicaid applications for chronic care is completed typically once a person is placed in the facility and is expected that the stay will be longer than 29 days. And there is a resource test for this program, and it's a documentation of resources for the past 60 months. Most people know it as the 5-year look-back period. The Medicaid buy-in for working people with disabilities is another Medicaid program, and this program allows people with disabilities who are working and earning more than the allowable limits for regular Medicaid, up to 100% of the federal poverty level, which I mentioned before, to now access Medicaid up to 250% of the federal poverty level. This allows working people with disabilities to earn more income without the risk of losing Medicaid coverage. So for 2020, for a household size of 1, the income goes up to $63,492 for the year. The resource level is $20,000. For a household size of 2, that income level goes up to $85,572 per year, with a resource level of $30,000. Now, when you're over the Medicaid income level, the amount over is called excess income or the spend down amount. And this means that Medicaid is not active until an individual has satisfied their spend down, and it's a spend down that needs to be satisfied every month. Now, there's ways to eliminate or satisfy a spend down. And one is to provide proof of medical bills to the local district that meet or exceed that monthly spend down each month. You can pay the monthly spend down each month directly to the Department of Social Services, same way that you would, pay for a typical health insurance premium. Or you can provide proof of medical bills, a combination of medical bills that don't exactly meet the spend down, and then you can pay the difference. The other option is to set up a pooled income trust. Now, pooled income trusts create a separate account managed by a charitable care organization, and the spend down amount is transferred to that separate account every month, and the individual directs the charitable organization managing the account to pay certain allowable expenses with funds in that account. And the requirements for eligibility to set up a pooled income trust includes: 1, the individual must be disabled, and this does include age-related conditions. Funds in the trust can only be used for the benefit of the Medicaid applicant, and funds can only be used for allowable expenses. And when the Medicaid recipient passes, any remaining funds in the account belong to the charitable care organization. So it's important to just put the amount of your spend down in that trust and make sure that you utilize that money every month. Allowable expenses for a pooled income trust include clothing and food, living expenses such as the rent, mortgage, real estate taxes, utilities, travel expenses such as gas and car payments, entertainment, attorney, accountant, guardian fees, supplemental home care services, geriatric care services, and medical procedures not covered by Medicaid. Overall, the purpose of a pooled income trust is to allow an individual to pay for living expenses and still be eligible for Medicaid benefits. Now, when a person is enrolled in Medicare Part A, which covers hospital coverage, Part B, which is the doctors, and Part D, which is prescriptions, or they're in a Medicare Advantage plan, also referred to sometimes as Part C, and enrolled in Medicaid at the same time, this is called being dual eligible. So Medicaid, is the payer of last resort and works as a supplementary plan covering the 20% that Medicare does not cover. And it also covers the premiums for Part B and for Part A if a person is not eligible for free Part A. And when a Medicare beneficiary has Medicaid, they are automatically enrolled in Extra Help, which can pay for a lower or no monthly Part D premium, and it can also lower the cost of prescription drugs. There are resource limits for Medicaid. I mentioned them before. I just want to go over what is considered a resource. So some examples are checking and savings accounts, an IRA, a 401k, stocks, bonds, mutual funds, cash value of life insurance policies, and other real property such as a second home or a vacation property. And if a person is over the resource limit but needs Medicaid for long-term care or chronic care services, we typically advise people to speak to an elder care lawyer regarding asset protection, because that's the best place to go in order to discuss those things. But if a person is over the resource limit and they do not need long-term care or chronic care services, they have the option of enrolling into something called the Medicare Savings Program. Now, the Medicare Savings Program assists individuals and couples pay their Medicare premiums, coinsurance, and deductibles. And there are 4 Medicare Savings Programs. The first is the Qualified Medicare Beneficiary, known as QIMBY. Then there's the Specified Low Income Medicare Beneficiary, known as SLMB. There's the Qualifying Individual, also known as QI. And then there's the Qualified Disabled and Working Individual. Now, for the first program I mentioned, Qualified Medicare Beneficiary, this program goes up to 100% of the federal poverty level. A single person can make $1,061 per month, up to $1,061 per month, and a couple can make up to $1,430 per month. And as I mentioned, there is no resource limit. And this pays for Part A and or Part B premiums. Most people are eligible for free Part A, but for those that aren't, this program helps pay for the Part A premium, which could be very expensive. They also can be eligible for QIMBY only or QIMBY and Medicaid. So for some folks, depending on their income, they can be enrolled in both programs simultaneously. And this program also pays for the Part A and Part B coinsurance and deductibles. For the Specified Low Income Medicare Beneficiary, this program goes up to 120% of the federal poverty level. The income for a single person is up to $1,269 per month. For a couple, it is up to $1,711 per month. There is no resource limit. And this program pays for the Medicare Part B premium only. And you can be eligible for SLMB alone or for SLMB and Medicaid, but you will have a spend down, a Medicaid spend down. So an individual must be enrolled in Part A to be eligible for the program. For a qualified individual, this program goes up to 135% of the federal poverty level. For a single person, this comes to up to $1,426. For a couple, that goes up to $1,923, sorry. Again, no resource limit. This pays for Medicare Part B only. And you cannot be eligible for QI and Medicaid. Depending on your needs, you would have to pick one program over the other because you can't be enrolled in both. And the individual must be enrolled in Medicare Part A in order to be eligible. Now, qualified disabled and working individuals is a little different. This is the only program that has a resource limit, but this does go up to 200% of the federal poverty level. A single person can make $2,102 per month. A couple can make $2,840 per month. And this pays for the Medicare Part A premium only, not the Part B. For this program, an individual must be disabled, a disabled worker under the age of 65 who lost Part A benefits because they returned to work. The income limits are 200% of the federal poverty level, but they do include some substantial income deductions. It does not include, for example, it does not include the first $65 of earned work income, and then 1/2 of the earned income remaining after subtracting the $65 is also deducted from the gross monthly income. So even though that you look at the two income limits, if you know somebody that would be may be eligible for this program and is making a little more money than that, you really should still encourage them to apply for this program because of the earned income deductions, could prove that they are eligible for the program. Now, there are some added benefits for qualifying for a Medicare Savings Program. And one of the biggest benefits is that if an individual missed the enrollment deadline for any part of Medicare, enrollment in an MSP waives the lifetime enrollment penalties and allows enrollment into Part B year-round than only during the annual enrollment period. So if you know of somebody who turned 65, they were supposed to enroll, they didn't because they couldn't afford it or whatnot, or they didn't think they needed it. Once they've passed that eligibility point or their enrollment period, they will incur lifetime penalties. So applying for one of these programs and finding out that you're eligible for it is another way to get into the program and waive those lifetime penalties. Another added benefit of being in the Medicare Savings Program is that depending on your income, you can qualify for extra help or Part D, and that helps pay for your prescription drugs. So how do you apply for non-Magi Medicaid and Medicare Savings? You can meet with a certified application counselor from the Nassau-Suffolk Hospital Council's Medicaid Enrollment Assistance Program for the aged, blind, and disabled populations. As I mentioned before, we're currently not doing face-to-face application assistance, but we are doing everything by phone, and it actually is working out pretty well. So applications, like I mentioned, are currently being done by phone, and you could call the numbers below to be assigned an enroller that will assist you. So during normal working hours, Monday through Friday from 9 a.m. to 5 p.m., you can call 631-435-3000 and ask to be assigned to an enroller that will assist you. After work hours, please call 631-656-9783 and press option 2. Leave a message and somebody will call you back within the next business day. And there's always the local departments of social services that are also available to assist in the application process. So thank you. That ends my program for today. If you have any additional questions or you have a specific case that you want to discuss, please call 631-435-3000 and ask for me, Stacy Villagran, or email me at S as in Sam, V as in Victor, ILLAGR@nshc.org. I want to thank you very much for listening to me today. Please feel free to call our office. Our staff has tons of experience, and we are really here to help you as best as possible. So please just give us a call. And like I said, we'd be more than happy to help you. Okay? Stay safe, take care, and maybe I'll be talking to you soon. Thank you.